Right, we're all lined up. It's a four-hander, so we've got to be really quick. My name's David Evans. I'm the Medical Director of Northumbria Trust. Nobody knows where Northumbria is. We're the very top right-hand corner. We go from the River Tyne up to the Scottish border, east coast into the middle of the Pennines. 2,500 square miles, 500,000 people. How mad is that? We deliver care on 10 inpatient sites. Those of you who are glued to the BBC special over the weekend will have heard us talking about our new model of emergency care. I was broadcast on radio too. I never thought I'd hear myself say that. So we've been breaking the mould. In fact, we've thrown the mould away, and we've been changing things for about 15 years. We're proposing a hospital group based around collaboration. Our new model of emergency care we have already shared with over 20 trusts who've come to visit us and look at the way we work. Before I'd even got my cup of tea this morning, 2 more trusts have asked to come and see how we're working. So we're well used to collaboration and sharing. We have 3 strands. The clinical strand, which is about unifying patterns of care and unifying standards. Because we deliver care on 10 inpatient sites, that's the way we work. You go into a treatment room in any one of our hospitals, it's the same. You go onto a patient pathway in any one of our hospitals, it's the same. We've standardised that and we've worked well. We've improved safety and quality, we've improved patient experience, and we've reduced costs. There can't be many trusts in the NHS at the moment who've been having serious discussions over the last month about how many more beds we can close because our new emergency care centre is working so well. The other thing that we've done is back office function, that is strand 2. Some of you sitting here today may not realise that when your pay slip arrives at the end of the month, it's actually come from Northumbria. You may not realise that your trust's bills are paid by Northumbria. A lot of you driving lease cars may not realise that NHS Fleet Solutions is wholly owned by Northumbria and puts money straight back into patient care. When they said in 1959, we will put a hospital in every district, nobody realised the back office function that was going to develop to support that. We believe we can help to really change that. And the third thing is about our networking. I've described how we've been doing that already, and I think there's more to do. Claire.
How do I follow that? Anyway, our approach has been developed and refined over a number of years, building on the experience we have gained working across public and private sector organisations. That's both in and out of area. Our experience with Northumbria has also helped to develop a deeper understanding of approaches and models that will work as a result, all of which positions our trust ready now to form a hospital group. But we, unlike any other NHS organisation, offer something different. Part of our bids creates the opportunity to spread and share further back office functions, already providing services at scale and able to extend further, but also generate income which can be reinvested in patient care. An example of this is NHS Fleet Solutions. Dave has already mentioned that. A service that already works with over 160 NHS organisations and generates income for all of the partners operating within that model. This model already generates millions of pounds for the NHS and actually funding nurses on the ground now. In addition, our services such as payroll, NAP, which is financial systems, and home electronics are all positioned to provide services now to NHS organisations, enabling greater economies of scale and the opportunities for income generation across multiple organisations. Our experience working within the NHS also has proven our ability to extend the shared service offering further. Corporate services such as HR, OD, finance, estates and communications and engagement, all departments are already providing strategic advice and services via SLAs to other organisations and to have developed service offerings based on best practice. Work includes the better management of PFI contracts as an example, as well as hospital estate. Our work to date and entrepreneurial approach has impacted dramatically on the Trust's efficiency, which has been recognised nationally as part of the Lord Carter Review as one of the best in England. We should not really compete internally across the NHS to be top of a league table on how efficient we are. This should be core to how we do things, eradicating waste and providing the best possible care to patients.
So what will we do? Our hospital group will have a standard operating model which will focus on what's right for patients and the public. From the development of a robust framework for continuous improvement, the development of networks to tackle issues such as mortality and sepsis, through to clinical engagement, all tried and tested models of working that can support any organisation on their journey of continuous improvement. Based on our experience to date and partnership working, we believe within year one we can deliver on 6 key components. Number 1, develop a hospital group that includes, as part of phase 1, an out-of-area partner, namely Northumbria University Hospital Trust. Number 2, identification of phase 2 partners that will allow us to develop clinical networks and the production of a standard operating model scalable across organisations regardless of location. Number 3, introduction of a corporate shared service function. Number 4, benchmark performance to enable the effective measurement of the hospital group. Number 5, agree a robust governance framework, learning from the best practice internationally within health markets, private sector group organisations and multinationals. And finally, introduction of clinical networks that support the sharing and spread of best practice, clinical strategies and the effective clinical engagement of teams.
Our track record speaks for itself. We've proved that across now 11 hospital sites and many community and social care sites, which are geographically dispersed and serving a vast communities around urban, rural and coastal areas, we can still provide some of the best care in the NHS, along with the most satisfied staff. We are therefore confident that we can do this with others. Like everyone in the room today, and indeed everyone else working across the NHS, we know we all face the same core challenges. It is no longer possible for organisations to regard themselves as separate entities. We all have a part to play in working together, sharing knowledge, sharing expertise, and agreeing common solutions and ideas. We know that many of the solutions to the core challenges that we've faced are already out there within the NHS family, and yet we rely on support from external organisations or indeed are internally challenged and restricted by asking for the advice and support we need. So our hospital group will break down the barriers that prevent the NHS from working together well. We will ensure that partner organisations learn from one another and can create an open and collegiate culture that is focused on working with patients to improve care. Thank you. We'd welcome your questions.
Hello. Gordon Cairns. I'm a patient representative. I do a little bit for West Cheshire CCG as a patient leader. Patient involvement at a high level is what I want to see, not just tick boxes and things like that. Patient involvement at a high level, meaning at a board level. Thank you.
Hi, just to answer that, Northumbria has one of the largest membership with over 60,000 members and one of the largest governing bodies, which is over 71 governors. Part of that, also, we have a patient testing panel in partnership with our local clinical commissioning group, and we are constantly engaging with our patients and the public regarding the services that we provide. And in fact, in some areas, co-design some of the services around those needs, especially those in the community. So it's absolutely essential that we build that model across our hospital group. And actually, Northumbria is also seen as an exemplar in this area.
Do we have some more questions? Ladies down front here.
Glenys Goodwill, Durham. How are you doing with 7-day working?
So you didn't listen to the BBC yesterday, no. We've had 7-day working by consultants in place for over 10 years. We moved in 2004. Our emergency stream is at 7-day all that time. We moved to 24-hour resident A&E consultants in June this year. So I think we're doing pretty well.
We squeeze one more question in. I think there's a hand there.
Hello there. My name is Trevor Fernandez. I chair a number of national patient groups, and I also co-chair the East of England Citizen Senate. One of the issues that our groups are telling us quite often and very concerned and worried about is the workforce, and in particular sustaining it. What will you, or rather, what are you planning to do in terms of making sure we have the right workforce in the right place at the right time?
Okay. Incrementally, over the last 10 years, as we've been moving to the major change in the way we provide emergency care, we have completely redesigned our workforce, and we've moved away from the traditional three-tier medical model. We've invested heavily in clinical pharmacists who work in the acute stream. We've invested heavily in specialist nurse practitioners who work in the acute stream, and we have a very stable and very satisfied workforce. I think the approach we've taken, recognising that the existing NHS model of how we provide urgent care just wasn't going to work, stands us in good stead. Also, Northumbria has a good record of stability. We've had 2 chief executives in 20 years. I've been medical director for 12 years. We have 3 generations of some families who work for us. We're seen as an employer of choice, and we allow people to work to their skills and develop their skills.
Thank you for that. You haven't once mentioned Health Education England. They have got a budget for developing, training and delivering the workforce.
Yep.
How are you going to work with them to first of all, to identify where the areas of need are, and secondly, to try and incentivise GPs, for example, to work there?
Sure. That's part of our standard practice. Both our Chief Executive and I sit on the governing body of health education in the North East. We work very closely with them. We now employ GPs directly within our trust. We are managing 5 practices now, and we have GPs working within our acute care stream. So I think we have got a foot in the door there, if you like, on different ways of working within primary and secondary care. Everywhere I've been around the world, they say, "Isn't your NHS fantastic? But what's this cockamamie primary secondary care divide? We just don't understand it, and neither do I. I think we need to work differently." Yeah.
We have to leave it there. Thank you very much indeed. Thanks very much to Northumbria Foundation Group.